Sustainable Development Goal 3, Goal 3, Goal 3. Sustainable Development Goal 3 SDG 3 or Global Goal 3 regarding good health and well-being is one of the 17 Sustainable Development Goals established by the United Nations in 2015. The official wording is to ensure healthy lives and promote well-being for all at all ages. The targets of SDG 3 cover and focus on various aspects of healthy life and healthy lifestyle. Progress towards the targets is measured using 21 indicators. SDG 3 has 13 targets and 28 indicators to measure progress toward targets. The first 9 targets are outcome targets. Those are reduction of maternal mortality, ending all preventable deaths under 5 years of age, fight communicable diseases, ensure reduction of mortality from non-communicable diseases, and promote mental health, prevent and treat substance abuse, reduce road injuries and deaths, grant universal access to sexual and reproductive care, family. The 4 means to achieving SDG 3 targets are implement the WHO Framework Convention on Tobacco Control, support research, development and universal access to affordable vaccines and medicines, increase health financing, and support health workforce in developing countries, and improve early warning systems for global health risks. SDG 3 aims to achieve universal health coverage that seeks equitable access of healthcare services to all men and women. It proposes to end the preventable death of newborns, infants, and children under 5, child mortality, and end epidemics. Good health is essential to sustainable development and the 2030 Agenda. It focuses on broader economic and social inequalities, urbanization, climate crisis, continuing burden of HIV and other infectious diseases, not forgetting emerging challenges such as non-communicable diseases. Considering the global pandemic of COVID-19, there is a need to give significant attention towards the realization of good health and well-being on a global scale. Background, targets, indicators, and progress. The UN has defined 13 targets and 28 indicators for SDG 3. The main data source and maps for the indicators for SDG 3 come from our World in Data's SDG tracker. The targets of SDG 3 cover a wide range of issues, including reduction of maternal mortality Target 3.1, ending all preventable deaths under 5 years of age Target 3.2, fight communicable diseases Target 3.3, ensure a reduction of mortality from non-communicable diseases, and promote mental health Target 3.4, Target 3.1, reduce maternal mortality. The full text of Target 3.1 is by 2030, reduce the global maternal mortality ratio to less than 70 per 100,000 live births. Indicator 3.1. 1. Maternal mortality ratio. The maternal mortality ratio refers to the number of women who die from pregnancy-related causes while pregnant or within 42 days of pregnancy termination per 100,000 live births. Indicator 3.1. 2. Percentage of births attended by personnel trained to give the necessary supervision, care, and advice to women during pregnancy, labor, and the postpartum period, to conduct deliveries on their own and to care for newborns. The unequal status of women and girls, lack of decision-making powers, knowledge. 2. Target 3.1 aims to reduce maternal mortality to less than 70 deaths per 100,000 live births. Though the maternal mortality ratio declined by 37% between 2000 and 2015, there were approximately 303,000 maternal deaths worldwide in 2015, most from preventable causes. In 2015, maternal health conditions were also the leading cause of death among girls aged 15–19. Data for girls of greatest concern, those aged between 10 and 14 years, is currently unavailable. Key strategies for meeting SDG 3 will be to reduce adolescent pregnancy, which is strongly linked to gender equality, provide better data for all women and girls, and achieve universal coverage of skilled birth attendants. Target 3.2, and all preventable deaths under 5 years of age. The full text of Target 3.2 is, by 2030, and preventable deaths of newborns and children under 5 years of age, with all countries aiming to reduce neonatal mortality to at least as low as 12 per 1,000 live births and under 5 mortality to at least as low as 25 per 1,000 live births. Indicator 3.2, 1 under -5 mortality rate. The under -5 mortality rate measures the number of children per 1,000 live births who die before their 5th birthday. Indicator 3.2, 2 neonatal mortality rate. The neonatal mortality rate is defined as the share of newborns per 1,000 live births in a given year who die before reaching 28 days of age. Globally, the risk for children dying before age 5 was reduced by 44% since 2000, reaching 43 deaths per 1,000 live births in 2015. Still, a large number of preventable deaths remain, with about 16,000 children under the age of 5 dying every day in 2015. 3. The neonatal mortality rate declined from 31 deaths per 1,000 live births in 2000 to 19 deaths per 1,000 live births in 2015. Though neonatal mortality is decreasing, the proportion of the global under 5 mortality is increasing, signaling a need to ramp up focus on antenatal care programs. 3. The COVID-19 pandemic in 2020 results in fewer women and their babies having access to life-saving care. This is because many healthcare facilities are even more short-staffed and under-equipped than usual. This can negatively impact the under 5 mortality rate as well as the neonatal mortality rate. 29. Target 3.3. Fight communicable diseases. The full text of Target 3.3 is, by 2030, end the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases and combat hepatitis, waterborne diseases, and other communicable diseases. Indicator 3.3, 1. Number of new HIV infections per 1,000 uninfected population. Indicator 3.3, 2. Tuberculosis per 100,000 population. Indicator 3.3, 3. Malaria incidence per 1,000 population. Indicator 3.34, hepatitis B incidence per 100,000 population. Indicator 3.35, number of people requiring interventions against neglected tropical disease. Target 3.3 proposes to end the preventable death of newborns and children under 5 and to end epidemics such as AIDS, tuberculosis, malaria, and waterborne diseases, for example. Similarly, progress has been made on increasing access to clean water and sanitation, and on reducing malaria, tuberculosis, polio, and the spread of HIV/AIDS. From 2000 to 2016, new HIV infections declined by 66% for children under 15 and by 45% among adolescents aged 15–19. However, current trends mean that 1 out of 4 countries still will not meet the SDG target to end AIDS among children under 5, and 3 out of 4 will not meet the target to end AIDS among adolescents. Overall, AIDS remains the leading cause of death among women aged between 15 and 49 years, as approximately 1,800 young people being newly infected with HIV every day. This underscores the importance of ensuring that young people can fully exercise their rights to access sexual and reproductive health and HIV information. 3. In 2015, there were an estimated 10.4 million new TB cases, 1 million of which were under age 15, corresponding to 142 cases per 100,000 population. The malaria incidence rate was 91 per 1,000 persons at risk, representing a 41% decrease globally between wild deaths. With regards to HIV infections, people living with HIV are at increased risk of death due to COVID-19 in the year 2020. Also, disruptions to health services can result in people not getting antiretroviral therapy (ART), which would result in more deaths. 30. Target 3.4. Reduce mortality from non-communicable diseases and promote mental health. The full text of Target 3.4 is by 20. Indicator 3.4. 1. Mortality rate attributed to cardiovascular disease, cancer, diabetes, or chronic respiratory disease. Indicator 3.4. 2. Suicide mortality rate. Deaths caused by the four main INCIDI were 17.7 million from cardiovascular diseases, 8.8 million from cancers, 3.9 million from chronic respiratory diseases, and 1.6 million from diabetes. The risk of dying from the four main INCIDI between ages 30 and 70 decreased from 23% in 2000 to 19% in 2015. Target 3.5. Prevent and treat substance abuse. The full text of Target 3.5 is strengthen the prevention and treatment of substance abuse, including narcotic drug abuse and harmful use of alcohol. Indicator 3.5. 1. Coverage of treatment interventions, pharmacological, psychosocial and rehabilitation, and aftercare services for substance use disorders. Indicator 3.5. 2. Harmful use of alcohol, defined according to the national context as alcohol per capita consumption aged 15 years and older within a calendar year in liters of pure alcohol. In 2016, worldwide consumption of alcohol was projected to be 6.4 liters per person aged 15 and older. Consumption is increasing in the Western Pacific and Southeast Asia regions, while remaining relatively stable in others. The available data is inadequate, and much further work is needed to improve the measurement of treatment coverage for alcohol and drug use disorders. 5. Target 3.6. Reduce road injuries and death. The full text of Target 3.6 is, by 2020, have 50% less the number of global deaths and injuries from road traffic accidents. Target 3.6 has only one indicator, Indicator 3.6. 1 is the death rate due to road traffic injuries. The need for improvements in safer infrastructure and government regulation continues. In countries with great success, such as Sweden that boasts a 66% reduction in injury and deaths from 1990 to 2015, tough government regulation has been key. In November 2009, at the request of the UN General Assembly, the first global ministerial conference on road safety was hosted by the government of the Russian Federation. Following the success of the conference, the Decade of Action for Road Safety 2011-2020 declared in March 2010 by the United Nations General Assembly. In February 2020, the third Global Ministerial Conference on Road Safety was held in Stockholm, Sweden. The outcome of the conference was the Stockholm Declaration that set a global target of reducing road traffic deaths and injuries by 50% by 2030. In August 2020, the United Nations ratified the Stockholm Declaration declaring 2021-2030 the second decade of action for road safety. Target 3.7. Universal access to sexual and reproductive care, family planning, and education. The full text of Target 3.7 is, by 2030, ensure universal access to sexual and reproductive health care services, including for family planning, information and education, and the integration of reproductive health into national strategies and programs. Indicator 3.7. 1. Percentage of married women ages 15-49 years whose need for family planning is satisfied with modern methods of contraception. Indicator 3.7. 2. Adolescent birth rate aged 10-14 years, aged 15-19 years per 1,000 women in that age group. Half of the women in developing countries have received the health care they need, and the need for family planning is increasing exponentially as the population grows. While needs are being addressed gradually, more than 225 million women have an unmet need for contraception. There is a slight increase in the proportion of women of reproductive age who were married or in union. In West Africa, the number of women using contraceptives more than doubled between 2011 and 2020. 34. Target 3.8. Achieve universal health coverage. The full text of Target 3.8 is achieve universal health coverage, including financial risk protection, access to quality essential health care services, and access to safe, effective, quality, and affordable essential medicines and vaccines for all. Indicator 3.8. 1. Coverage of essential health services. Indicator 3.8. 2. Proportion of population with large household expenditures on health as a share of total household expenditure or income through the lens of leaving no one behind. Universal health coverage UHC includes migrants and refugees, many of whom may not have legal status or are unaccounted in financial risk protection schemes. 6. Primary health care PHC is the most important pathway to achieve universal health coverage. 35. This because it can address more than 80% of a person's health needs and is accessible and affordable. In 2020, the COVID-19 pandemic resulted in a reduction in the Universal Health Coverage Effective Coverage Index, an index which assesses whether people in a country have access to essential health services. 35. Target 3.9. Reduce illnesses and deaths from hazardous chemicals and pollution. The full text of Target 3.9 is, by 2030, substantially reduce the number of deaths and illnesses from hazardous chemicals and air, water, and soil pollution and contamination. Indicator 3.9. 1. Mortality rate attributed to the household indoor and ambient outdoor air pollution. Indicator 3.9. 2. Mortality rate attributed to unsafe water, sanitation, and lack of hygiene. Indicator 3.9. 3. Mortality rate attributed to unintentional poisoning. Household air pollution is estimated to cause half of all pneumonia deaths among children under age 5. The global mortality rate from unintentional poisonings decreased by 33% between the years 2000 and 2015, but still causes 108,000 deaths annually. 6. Target 3A. Implement the WHO Framework Convention on Tobacco Control. The full text of Target 3 is strengthen the implementation of the World Health Organization Framework Convention on Tobacco Control in all countries as appropriate. Target 3 has only one indicator. Indicator 3A1 is the age-standardized prevalence of current tobacco use among persons aged 15 years and older. The WHO Framework Convention on Tobacco Control has been ratified by 180 parties representing 90% of the global population. More than 80% of parties have either adopted new or strengthened their existing tobacco control laws and regulations. 7. In 2019, the global average value for the age-standardized smoking prevalence among ages 15 and older was 17%. Down from nearly 25% in 1990, which is a positive development. 36. The COVID-19 pandemic might accelerate this trend because people might stop buying tobacco if their income drops. Also, people have learned that smokers are more likely to get seriously ill or die from COVID-19, which might cause them to smoke less. 36. Target 3B. Support research, development, and universal access to affordable vaccines and medicines. The full text of Target 3B is support the research and development of vaccines and medicines for the communicable and non-communicable diseases that primarily affect developing countries, provide access to affordable essential medicines and vaccines in accordance with the Doha Declaration on the TRIPS Agreement and Public Health, which affirms the right of developing countries. Indicator 3B1. Proportion of the target population covered by all vaccines included in their national program. Indicator 3B2. Total net official development assistance ODA to medical research and basic health sectors. Indicator 3B3 proportion of health facilities that have a core set of relevant essential medicines available and affordable on a sustainable basis. The current landscape of health research and development R&D is insufficiently aligned with global health demands and needs. As little as 1% of all funding for health R&D is allocated to diseases that are predominantly incident in developing countries. 7 SDG 3 aims to achieve universal health coverage, including access to essential medicines and vaccines. 2016 rates for the third dose of the pertussis vaccine DTP3 and the first dose of the measles vaccine MC-VON reached 86% and 85%, respectively. Yet, about 20 million children did not receive DTP3, and about 21 million did not receive MC-VON. Around 2 in 5 countries will need to accelerate progress in order to reach SDG targets for immunization. Immunization averts an estimated 2 million minus 3 million deaths every year. In 2016, global coverage rates for the third dose of the diphtheria, tetanus pertussis vaccine DTP3 and the first dose of measles containing vaccine MC-VON reached 86% and 85%, respectively, up from 72% for each in 2000. Despite this increased coverage, about 20 million children did not receive 3 doses of DTP, and about 21 million missed the first dose of MCV. 35 due to the COVID-19 pandemic in 2020, the gradual progress made in the past years with immunization faces a huge decline. With highly contagious diseases like measles, this poses a bigger risk to the world's children. However, some of the affected countries have already implemented measures to respond and combat this disruption. By combining health campaigns for vaccines, deworming pills, bed nets, etc., communities can receive several services all at the same time instead of one by one. This can increase coverage while minimizing exposure during the pandemic. 37 Another viable route to attain this target is to accelerate COVID-19 vaccination opportunities to people who are often underserved by community vaccination programs, for example, prisoners. Experts have called for people in prisons to be prioritized for the national COVID-19 vaccinations strategy, given their risk profile of underlying chronic conditions, age, and living environment. Target 3C increase health financing and support health workforce in developing countries. Target 3D improve early warning systems for global health risks. The full text of Target 3D is strengthen the capacity of all countries, in particular developing countries, for early warning, risk reduction and management of national and global health risks. Indicator 3D1 International Health Regulations IHR Capacity and Health Emergency Preparedness. Indicator 3D2 Percentage of bloodstream infections due to selected antimicrobial resistant organisms. The 2016 IHR review process acknowledged the need to include migration and mobile populations in epidemic and pandemic preparedness and response plans. Pandemic preparedness and global health security require across-the-board upscaling of IHR implementation. 7. Custodian agencies. Custodian agencies are in charge of reporting on the following indicators. Indicators 3.11, 3.2, 1, 3.22, 3.41. Indicator 3.1. 2. United Nations International Children's Emergency Fund UNICEF. Indicator 3.3. 1. Joint United Nations Program on HIV/AIDS. Indicators 3.32, 3.33, 3.34, and 3.35. UNICEF. Indicator 3.5. 1. The World Health Organization and the United Nations Office on Drugs and Crime. Indicators 3.7. 1 and 3.7. 2. United Nations Department of Economic and Social Affairs. Indicators 3.8. 1 and 3b1. WHO and UNICEF. Indicator 3B2 Organization for Economic Cooperation and Development OECD. Monitoring. An annual report is prepared by the Secretary General of the United Nations evaluating the progress towards the Sustainable Development Goals. In 2017, the UN High-Level Political Forum published a thematic review of SDG 3. Investing in multi-stakeholder partnerships to remove barriers to equitable health services which are responsive to increasingly diverse population health needs, and to reach those most further behind first is essential for the 2030 Agenda for Sustainable Development. Strong commitment by UN member states and the international community to ensuring good health and well-being is achieved is therefore emphasized. Challenges. Impact of COVID-19 pandemic. Limitations and potential implications. An annual report is prepared by the Secretary General of the United Nations evaluating the progress towards the Sustainable Development Goals. In 2017, the UN High-Level Political Forum published a thematic review of SDG 3. Investing in multi-stakeholder partnerships to remove barriers to equitable health services which are responsive to increasingly diverse population health needs, and to reach those most further behind first is essential for the 2030 Agenda for Sustainable Development. Strong commitment by UN member states and the international community to ensuring good health and well-being is achieved is therefore emphasized. A recent analysis in 2017 showed that the input, outcome, and impact indicators has limitations in their approach. SDG 3 tracks population health across many different disease states. However, it possesses several limitations according to this analysis. It does not track protection from financial risk, primary health care inputs, how satisfied users are with the healthcare system, and does not provide with a way to tackle the prevention, diagnosing, treatment, and management of various diseases. 32. Firstly, primary health care. There are no indicators for primary health care, only 2 indicators for resource management, healthcare worker density, and hospital access. This does not factor in key primary healthcare systems and community inputs, such as accessing a PHC clinic, health education, or the availability of essential medicines at these clinics. PHC is a foundation for improving population health and allows a step towards a strong health system with universal health coverage. 33 Policymakers and practitioners should look at and think about how to add PHC into achieving SDG 3. 32. Secondly, no comprehensive approach is present for being able to diagnose, prevent, manage, and treat any disease. An impact indicator gets information from a preceding output indicator from either public or healthcare services, but never both. This means that SDG 3 focuses on targeted interventions for priority diseases, but does not promote an approach for preventing, diagnosing, treating, and managing any disease. Additionally, the output indicators do not include preventative health behaviors, such as condom use, physical exercise, or nutrition. Furthermore, 5 of the impact indicators have no preceding outputs, but they can be easily addressed through environmental health and other programs. Policymakers should be aware that the guidance given in SDG 3 is only a summary, and more factors have to be considered in order to improve population health for each disease. Lastly, the indicators do not track financial risk protection or user satisfaction using healthcare services. If people are not protected against financial implications of using the healthcare system, this can lead to a decrease in access of care. 34 A patient's satisfaction with the healthcare system should also be monitored, as this can negatively impact the future interactions with the healthcare system. 35 Policymakers should be aware that by providing services to improve population health, this will have implications on financial status and satisfaction with the healthcare system, which is not portrayed in SDG 3. Links with other SDG. SDG 3 is interwoven throughout the 2030 Agenda, with its targets directly linking to targets in other goals. Among these are targets of SDG 2, 2.2, and all forms of malnutrition, SDG 4 4.1 free, equitable, and good quality secondary education, 4.2 good quality early childhood development, 4.7 knowledge and skills for sustainable development SDG 5, 5.2 eliminate all organizations dedicated to good health and well-being include the Global Fund to Fight AIDS, Joint United Nations Program on HIV/AIDS UNAIDS, World Bank, World Health Organization UNICEF, Department of Economic and Social Affairs DSA, United Nations Office on Drugs and Crime UNOC, Organization for Economic Cooperation and Development OECD, UN Women, Gavi the Vaccine Alliance, Vodafone Foundation, U.S.-based organizations. In the U.S., there are over 72,000 tax-exempt organizations working on issues related to UNSDG 3, according to data filed with the Internal Revenue Service (IRS) and aggregated by X4 Impact. X4 Impact, with the support of the Rockefeller Foundation, Ford Foundation, Hewlett Foundation, and Giving Tech Labs, created a free online interactive tool Health and Well-Being in the U.S. This online tool enables users to see health-related indicators nationally and by state, as well as relevant information for over 72,000 tax-exempt organizations in the U.S. working on issues related to UNSDG 3. The nonprofit data in the tool is updated every 15 days while the indicators are updated annually.